2 of Spooky South Coast. Tim Weisberg here, along with the silent assassin, Matt Costa. Stephanie Burke is at Mount Washington right now with Strange Escapes. They are there for the Mount Washington event up there. Stephanie is using an actual Frank's box tonight, a real, Frank's box that Frank made himself. I'm pretty jealous of that. And they're having a good time up there. But we are having a good time here as well. And as I mentioned, next week we will be at the Provincetown Paracon. Stephanie and I will be presenting together there. And we'll also be giving away a pair of tickets later on, maybe 2, to the daytime Saturday portion of the Provincetown Paracon. And we'll be giving away some pairs later on in the week as well. All you have to do to win them during the week is when you follow Provincetown Paracon on social media, follow them on Facebook. That's the best way to do it. And take some of those Provincetown Paracon posts and share them. And tag me in them. Tag Tim Weisberg in them when you share them. And then on Wednesday night, I'm going to have a list of everybody that's shared it and how many times they've shared it. And I'm going to write everybody's name down, and I'm going to cut it all up. I'm going to put it into a hat. I'm going to go on Facebook Live. I'm going to mix around all the names, and I'm going to pull the winners out of the hat. So you literally have the chance to have your name pulled out of the hat to win tickets to the Provincetown Paracon. So between now and Wednesday night, the Wednesday night cutoff will be at 8 p.m. because then I should be done with all my work in the news department. And then we'll put all the names in the hat, and we'll do it on Wednesday night at 8 p.m. So between now and then, share as many of those Provincetown Paracon Facebook posts, tag me in them, and you will be entered each time. You will get an entrance to win those tickets to the Provincetown Paracon. But we'll also be giving away some tonight, so stay tuned to the show in its entirety because we'll have a trivia question coming up for you at the end of the program. And now we're going to get back into the discussion with our guest tonight, Dr. Scott Kolbaba. We are talking about his book, Physicians' Untold Stories. And you can also check him out on the web as well. That is the name of the website as well, physiciansuntoldstories.com, if you want to go there and purchase the book and find out more about the good doctor who is coming back with us now. And thank you for holding during the news. I know that doctors, when they're used to a very fast-paced environment, and we try to keep things pretty laid back here, but we have to take the break for the news. We have to let the people know about what's going on. So thank you for holding on, Doctor.
Totally understand, Tim. By the way, my wife was born in New Bedford.
Oh, really?
Yes.
That's pretty coincidental. And at St. Luke's Hospital?
This was a long time ago. I'm not sure what hospital it was, but she was born there. We go back to Cape Cod every once in a while and drive through New Bedford.
Oh, that's awesome. Well, that's Matt Costa, my co-host, and I were actually from Wareham, from the gateway to Cape Cod. So
my goodness, that's where she lived also, Wareham.
Oh, wow, that's awesome. Small world.
It is.
And so, but now you're out in the Chicago area, right?
Yes, we are. Yeah.
And I know that just like we have in Boston. Here, there's a great medical community out in the Chicago area. A lot of groundbreaking research is done, and a lot of some of the top doctors in the country are located right there.
Right. We have a number of medical schools here, and it's quite a medical community.
And I guess when you have that type of community, it probably fosters a lot of, as we were talking earlier, like-minded thinking where a lot of doctors are tuning out the fact that this stuff can happen, that there is this greater power at work. But as you said, you started to hear some more of these stories. And obviously, whatever the process was for collecting these, we'll get into a little bit. But since the book has come out and since you've been out doing media, have you had more doctors that have been coming up to you and sharing with you stories and saying, hey, I had something weird that happened?
Yeah, there's some interesting things that have happened since the book has come out. The first thing that's happened is the doctors that share their stories were a little anxious about whether they would be criticized by patients, by other doctors, and so forth. And just the opposite. They've been heralded as people that have taken a lead in opening up the door between patients and physicians and discussing spirituality. So, and then one of the doctors, interestingly, that wanted to remain anonymous, the only one doctor wanted to remain anonymous in the book. And after we launched the book and he saw what laudits the other doctors were getting, he said, I don't want to be anonymous anymore. Put my name in and let people know who I am. So, and then what's also happened is we've gotten a number of other doctors that have written to me or communicated with me about their stories, and they want to, come forward with some amazing stories that they've had.
See, I'm a journalist by trade, and I've spent the last 11 years hosting the show, and I had to kind of ease into asking people about strange and unusual experiences. I've had to find a way to kind of ease into working it into conversations, and eventually I've reached the point now where, like, I have no problem just walking up to somebody I've just met and said, "Hi, I'm Tim. Hey, you ever have any ghost experiences?" I'm sure that it didn't work so well for you in trying to collect these stories for the book, that you had to kind of broach the subject gently to a lot of doctors, and also it probably took a while to collect some of these stories.
Yeah, it took me about 3.5 years to write the book. It was supposed to be a 6-month project, but I had a couple experiences myself, as I mentioned to you, and then a couple of other doctors just spontaneously came to me with their stories. But what I did to collect the rest of the stories was to hang out in the doctor's lounge, and the doctor's lounge has all kinds of wonderful things that attract doctors, like donuts and coffee and things like that. Occasionally, there's some good stuff like oatmeal and fruit. And I would go to the doctor's lounge early in the morning, probably 5:30 or so in the morning, and then any doctor that would come into the doctor's lounge, I would ask them if they had any experiences that they couldn't explain medically. And no one seemed to know exactly what I was talking about, so what I would frequently do is just tell them a story to give them an illustration of what I was looking for. And then they would say, "Oh, yes, I've got this story." And we talk a little bit about it because everyone's pretty busy in the morning trying to see patients before office hours and so forth. And then I would take their telephone number and call them sometime that week and get the details of the story. And we'd go back and forth like that for a number of sessions to get the story completely right. And then when I finally finished the story, I'd send it to them and say, proofread this, make sure that this is all completely accurate, because it's such an amazing story. No one wants to exaggerate, because the story is phenomenal enough in itself. So that's how I did that. And again, there were I probably interviewed close to 200 doctors. Lots of doctors had stories, but again, I picked out about 26 of the stories that I thought were the most special, that really touched my insides, and I put those in the book.
And I'm, with the book, you're looking for a variety of stories, but I'm sure as you were collecting these stories overall and collecting, over 200 stories, there must have been some thematic elements that came up. What was probably the most common type of experience that doctors were having?
These were all very different experiences, and I tried to avoid miracle cures. I have about 1 or 2 miracle cures in the book, because I think those tend to be a little bit boring after a while. And the stories that I collected were stories that I thought where doctors were touched by a divine hand, where they had some experience that it just defied scientific explanation. And I think, when you assemble a group of stories like this, you never know, at least I didn't know, what the bottom line was, what the final theme would be of the book. I just assembled these interesting and fascinating stories. And there are a couple of themes that I think that came out. One is a theme of love. Love seems to be, from the stories that I collected, one of the most powerful forces in the universe. And love can transcend time and eternity and everything. So the love of family members was a big theme. I think the other theme was that there's something else out there. There's a force out there that guides us and helps us to do the things that if we set our mind to do something, we will frequently, and doctors experience this, will frequently be guided and helped in strange and wonderful ways to accomplish those incredible goals. And I think one of the other themes was that people that have passed, friends and relatives that have passed, can sometimes communicate with us and help us in the things the good things that we're trying to accomplish. So those are some of the themes that seem to come out in the book.
Well, I noticed, in just talking with people myself, and as I had mentioned earlier in the show, one of the thematic elements of literature and of early mythology that fascinated me was the idea of a psychopomp. These beings that would come and would ferry the dead to their final destination. They'd be kind of the guiding hand that would lead people, whether it be to heaven or hell or the Greek mythology equivalents. It would be somebody whose job it was to ferry them to the other side. And I know that in talking with a lot of people who have been around loved ones who have passed in hospitals, there's always reports of loved ones who have come back to help them, loved ones who have appeared to them as they're dying, seeing that white light, seeing that tunnel appear before them as they're breathing their final moments. And I wonder if there's ever any time when the patients are experiencing this, if the doctors are experiencing some sort of version of that phenomena themselves at the same time.
Well, the patients report these kinds of things, and I've had a number of ER docs where you find lots of people that have arrested or come back from a death experience, and it's in the literature of the ER physicians that this is not an uncommon thing that happens, and we've had a number of doctors give me stories about these kinds of things. I'm just trying to think of one. Fred Bohofer is an ER doc in our emergency room, and he had a case where a person, a fellow in his 50s, came in to the ambulance, through an ambulance, who arrested in the ambulance, and they were doing CPR. He had to shock them back to life, and as soon as he administered the shock, his heart started again. He was in ventricular fibrillation. Came back, was awake for a while. Then as they wheeled him into the ER, he arrested again. They shocked him one more time. And then he was okay for a little bit as they wheeled him into the room, the heart room in the ER. He arrested again, shocked him back, and then they administered medications and so forth that kept him from arresting. And when he came to and was awake and reasonably alert, Dr. Bohofer noticed that he was unusually calm. And he said, you just had some real serious things happen to you. Are you okay? And he said, yeah, I really feel very, very calm about the whole thing. And he said, when I first arrested, I saw my father. It was very much, very lifelike, and it was as if I could touch him. He came to me, and he just stood there. He didn't say anything. And then the second time I arrested, he was joined by my wife. And then the third time, my brother came too. So there was my brother, my father, and my wife standing there, and they were just so real. I couldn't believe it, and they were a very calming influence on me, and I knew that I would be okay whatever happened to me. And Dr. Bohofer said, well, that's really nice, and I'm glad they provided some comfort to you. Will they be visiting you here in the hospital where you'll be in the intensive care unit for a little bit? And he said, no, because they've all died in the past. So obviously they had, I think his impression was that they had come to from the other side to take this individual back had he not survived the arrest. But he did, and he lived, and it was very calm because of the influence of his deceased relatives. And Dr. Bohofer said, I've read this a lot in the medical literature, that this thing is not unusual. This kind of thing happens all the time.
Well, I know that physicians will obviously study Elizabeth Kubler-Ross for the 5 stages of grief and for that aspect of things. But from a paranormal perspective, a lot of us will look at her work with near-death experiences and the work of Dr. Raymond Moody. Are these theories, are these stories that they discuss? Is this something that the medical community talks about as well?
Yeah, we do. And there are. Obviously there are stages of grief, but there are experiences that doctors have had with patients dying that are really unusual and strange. And we had one doctor, John Saran, who was a general internist, who had a neighbor that was dying of colon cancer, and when he was near terminal. He mentioned to his wife that I'm seeing 3 girls dancing in the living room, and his wife didn't see them, and she said, "Well, tell me about them." And she said he said they're all dressed in white, they're dancing, they're very young girls, and seem to be very happy. And she suddenly realized what was going on here, and she said to him, these are angels that have come to take you back. And he accepted that. He said, he said to her, I'll take care of things on the other side if you take care of things on the earth for our family. And she said, I would do that. And he then closed his eyes and died. And so she was convinced that these were angels that had come to take him back.
I think that's a comforting thought for a lot of people to think that there is someone who is going to be there for us. Obviously, we want our loved ones, our living loved ones around us when we die, but it's still the scary experience of going on to some unknown. So it's beneficial when somebody can come back and be there for us. So I'm not surprised that a lot of people see loved ones around them or angelic beings around them as they're passing. The white light has always been something that I've been fascinating with when people have near-death experiences in their report, seeing this light. And, you know, as was mentioned in the chat room, some people think it's, indicative of the birth canal and giving an argument to reincarnation. But I have a friend who actually had died, and they were able to bring him back. But during his experience, his death experience, it was not a bright light and loved ones. It was actually very negative, very traumatic, and he felt like he was essentially going to be tortured for eternity in just a few minutes that he was no longer with us. Do you get reports of that from people who have passed, and is there any kind of physical sign that they are going through something? When I know obviously when somebody dies, you're working on reviving them, but is there any kind of physical sign that you can see that they've been through something traumatic in those moments?
Well, a cardiac arrest and resuscitation and so forth is pretty traumatic. Most people, when they go through that, are really unconscious and not aware of what's happening to them. But in talking with some of the doctors that deal with death and dying all the time, the palliative care doctors, they are pretty positive that when people are dying, that they almost universally have positive experiences. They have, good, hopeful experiences. And obviously, there have been books written about near-death experiences where people were traumatized and they had a very bad experience. But the vast majority of people that are dying from the people that deal with this all the time, the palliative care doctors, tell me that their experiences are positive. They either see loved ones or have some feeling that they're going to meet their loved ones, and it's a positive experience and not a negative experience.
So, I mean, let's just say you're going into cardiac arrest and you don't have a pulse and the doctors are trying to bring you back. The brain is still active, though, at that time, right? For a little bit of time, would
Yes.
the brain instantly... So these things could be something happening in the subconscious. They could be a dream, essentially, that's happening to the people while they're going through this physical stress.
Exactly, and when the brain loses blood supply, it doesn't die immediately, and there are some physical things that can happen, such as a bright light and so forth, that can be explained by a lack of blood to the brain. So some of these things can be actually physical phenomenon that happens to the brain when a person is dying. But when they're brought back, then everything returns to normal. But that can, so it can be explained physically also.
But I'm sure that you've also collected stories and heard stories of people who were out of their bodies and can tell you about things that were happening in the room when they were in this type of a state.
We have, and there was one of the first stories that I heard. As a matter of fact, one of the first stories that actually got me really interested in collecting these stories was an experience that Dave Mokel had, one of my orthopedic surgical friends, and I was making rounds on the floor, and Dave literally ran up to me and said, "Scott, I've got this amazing story to tell you." And I said, "Go ahead, Dave." And he said, "Well, I can't tell it to you here because someone might hear me." I said, "Okay, let's go into a patient room where there were no patients." We closed the door. And he said that we had a mutual patient, Mary was her name, and Mary was going for an ankle surgery. Dave was an orthopedic surgeon doing the surgery. And when they administered the antibiotic to her, she arrested because of a reaction, an anaphylactic reaction to the antibiotic. No pulse, no respirations, eyes closed, no response to pain. She was dead, basically. They called a code in the OR, and when they call a code, everyone rushes in from the ORs around to try to help out. And one of the fellows that came in was a tech with unusually red hair underneath his surgical cap, and he started to do CPR. Well, Mary is a real big woman, and he wasn't doing adequate CPR, and Dave Mokel, who was feeling for a pulse, couldn't feel a pulse, so he asked him to stop doing CPR and he would take over. Well, after a couple times of asking, the individual wouldn't move away. Dave just gave him a push because in a code situation, that's a life and death situation. He was in charge. He had to make sure that things were done as properly as possible. So he pushed the guy aside. He stumbled away. Dave took over doing CPR, And after administering some medications, Mary came around again and lived, and she didn't wake up until the next day. But when she was leaving the hospital about 4 days later, after the cardiologist had cleared her and everyone else had signed off, he was telling her about some instructions to take care of her ankle. She said, "Thank you for saving my life, Dr. Mokel." And he said, "Well, it's just a team," and he's a very humble guy. It was a team effort. Everyone pitched in, and she said, "No, I saw you actually push that guy away with the red hair and start my CPR."
Wow.
By that point, Dr. Mokel got some weak knees and had to sit down because he was thinking, like, how can I explain this? And she mentioned multiple little minutia of the events that happened in the room. Dr. Mokel paging me, for example, looking at the door to see if I was coming, other people where they were standing, and so forth. And he said, "Well, how did this happen?" And she said, "When I rested, I rose. My something transported me to the top of the room, and I was able to look down on myself and see everything that was happening, and in great detail." And Dave asked her a few specific questions, and she was able to answer those questions, and he just had no explanation for it. And she said, when I was there, my grandmother, who had died 20 years before or so, came to me and told me that it was not my time to go, that if I was a good and honest person, that she would save a special place for her in heaven. And but this was not her time, and she'd have to go back, and then she did go back. And it's interesting that Mary was really not a very nice person before her arrest. Afterwards, she was the kindest and most gentle person in the world, and a joy to see in the exam room, and a joy to be associated with. She didn't live very long. She lived probably 3 or 4 more years because of multiple medical conditions. But that was one of the stories that really got me interested in asking doctors about their experiences, and really was an unbelievable experience. She was a mutual patient of myself and Dr. Mokel.
Well, I've had the opportunity over the last few years to work with a television show that investigates abandoned asylums and abandoned hospitals as one of the as the crux of what they do. And one of the stories that I've always shared with him, or one of the theories that I've always shared with him, is a lot of people die in hospitals, but there's a lot of positive energy that's expelled in hospitals as well, and for every death there's a birth, and for every life that goes there's one that comes in, and that's all going to leave some kind of an energetic imprint in these locations. So it's not always necessarily just the people who have died that cause hospitals to be haunted. But have you experienced stories and heard stories of what could only really amount to being a ghostly experience in a hospital or a medical facility?
Let me think about that. One of the most positive experiences that I can remember was a story about a little grandmother, Grandma O'Hanlon. Jack Heitzler is an obstetrician. He actually delivered 2 of our kids, and his wife, Joan, was delivering their 5th child. And Grandma O'Hanlon was a midwife. She was an elderly midwife. And as Joan was delivering the baby, Grandma O'Hanlon walked into the room and literally, with 2 obstetricians there, herself saved Joan's life. Let me go back and tell you a little bit about Grandma O'Hanlon. She was from Ireland. Her father sent her back because there was a big, brouhaha with Catholics and Protestants, and her father was hiding priests in secret rooms in their house, so he thought it was a little dangerous for her to be there, so he sent her to the United States, where she learned to be a midwife. She was kind of the spiritual leader of the family. She delivered lots of babies. She would also work for nothing if the family couldn't afford her. She'd give money to the poor, and she was quite a spiritual force in the family. When she became older, she couldn't deliver babies anymore, and she went to live with Joan and her mother, Joan Heitzler and her mother. And when Joan was a little girl, she always used to say, if I could make it to Grandma O'Hanlon's lap if I was in trouble, I know I'd be safe. And so when Joan was delivering their 5th child, she had delivered the baby, and then afterwards there was a fair amount of pain, and they had to do some procedures on her that caused some pain. And so one of the drugs that they administer in those days was a drug called trilene. Trilene is administered by a mask. It's a gas, and it puts a woman asleep so that she's totally unconscious, and then they are able to do their procedures, obviously. So Joan was ready to get the Trilene mask and to help with her pain when Grandma Hanlon stepped into the room, dressed in a little polka dot dress with a white sweater vest and her hair up, white hair up in a bun, and her old lady shoes. And she stood at the foot of the bed and shook her head. She said, "No, Joan shouldn't use the Trilene." So Joan Heitzler pushed it away, and she suffered some of the pain, but was able to tolerate it. But no one realized that Joan had eaten a large meal about an hour before she went into labor. And about a minute after she pushed the Trilene away, she vomited the entire meal. Now, had she been unconscious with the mask on, that vomitus would have been into her lungs, and she might have died from that or had a serious complication of aspiration pneumonia. And Joan said she made it to Grandma Hanlon's lap one last time, transcending time and eternity. Their love, their great love for each other, transcended time and eternity because Grandma Hanlon had died 22 years before that.
Mm. See, I don't know. For me, I would think that the last place spirits would want to hang around would be the hospital, unless for some reason they're trapped there. And that's part of, with what the Ghost Asylum program, part of the reason they would go to these places is trying to figure out why they would be trapped there. But I feel like, too, you are going to encounter, because we were talking before about people's loved ones coming and visiting them, and I wish my usual co-host Stephanie Burke was here because she's a psychic medium and she can experience these things firsthand, and she could give us a little more insight. But I feel like when people's loved ones are going to be around them all the time, you're going to happen upon them in these places. But some of these hospitals have spirits who are there all the time and who actually will influence the living that are there. I'm sure that it must come up from time to time amongst medical professionals, at least even on a halfway joking basis. That's when we're here alone, the lights go off and on their own. There must be some different types of weird phenomena that have happened to you or some of your colleagues.
Some strange things happen. We haven't experienced that much. One of the things I can think about, though, was a individual, one of my own patients that he had a heart transplant, and he lived for quite a while with his heart transplant and finally died. And his family was sitting around the living room talking about how much they loved him and what influence he had on the family and so forth, and they were telling all good things about him, and they were laughing that he would love to be there to hear all these good things that everyone was saying about him. And one of the family members said, "And I wonder if he could hear us now." All of a sudden, there was a surge of electricity in the lamp that was in the living room for about 5 seconds, and then it went back to the normal light. And the family decided that was his way of saying that he was there and he was listening to their conversation.
I know that in these days it's different. In modern times, you probably have a lot of patients that come in who have already self-diagnosed themselves through WebMD and, looking symptoms up on the internet, and they think that they have an idea of what they have, whether they're right or they're wrong, but at least they're coming in and they're already kind of having an idea in their head from what they've read on the internet or what they've seen on TV. Mm-hmm. Did you ever have anybody that came in and just kind of intuitively knew what was wrong with them, that it seemed like maybe they were diagnosing themselves early with something, or they just came in and seemed to have some sort of precognitive ability to know what was wrong with them?
These days medicine's gotten pretty sophisticated, and there's lots of lay literature about symptoms and so forth, and it's not unusual that I will see people in the office and they'll say, "I think I've got this or that condition," and sometimes they're spot on. It's really uncanny. Many times they're way off, but
right.
But it's not unusual for a person to do some research and diagnose themselves. I can't think of a case right now where a person had a premonition of something that they came in with. I've had doctors that have had premonitions of illnesses in patients, but not so many patients. And the one that's most striking to me was Dr. Rich Jorgensen, who's a general surgeon, and he one of his good friends was an appellate judge, And one night he had an amazing dream that his friend had died, and that he was laying in a coffin in a funeral home. And it was a vivid dream. He saw him dead and died of a heart attack. So the next day he called him up and he said, I hate to say this, but I had this vivid dream. And most dreams, when you wake up in the morning, they're gone.
Right.
You forget about the dream, but this one stayed with him a long time. And he called his judge friend up and he said, "Listen, I had this crazy dream that you were dead." And the judge laughed. What can you do when a person says that? And he said, I'd like you to get a physical. If you could just get a physical, it'd make me happy. And so the judge agreed. He hadn't had a physical for a long time. And so he went to see a doctor. The doctor did all the important tests, and everything was perfectly normal. He said, "Don't worry about dying of a heart attack. You're perfectly fine. Don't listen to this Dr. Jorgensen because he's and doesn't know. He hasn't examined you, and you're going to be fine." Well, when the judge talked to Dr. Jorgensen got this sick feeling in his chest again that this was something that he felt very strongly about, and he said, "I really want you to go to one of my cardiologists and have them see you because I still feel that there's something going on here that your doctor hasn't found." And the judge very reluctantly did that. They did a stress test, they did some other tests, and found ultimately that he had end-stage coronary disease. He had what's called a widowmaker plus other coronary disease, which usually gives you a life expectancy of less than 6 months. They put him in the hospital. He had bypass surgery the next day because they were afraid to wait too long, and that literally saved his life. He had some really, really serious coronary disease, and so Dr. Jorgensen felt that this dream was really something that led him to save his life.
I mean, that's very interesting because, we talk a lot with psychics, people who have psychic abilities here on the show, and as I mentioned, my co-host does, and we talk about how when they pick up on something medical, it's very much a slippery slope for them to mention what it is they're picking up on. That usually the way they try and do it is they'll say, "Listen, I really feel like you should go see a doctor. I'm picking up something about your chest." And even though they might have a vision of this person having a heart attack or something, they just try and keep it very generic because they don't want to come into any problems of predicting illnesses and running the risk of giving somebody the thought in their head that they have something wrong with them when they don't. But it does happen where sometimes people do see a psychic and the psychic will tell them, "You have cancer, you need to go find a doctor." And I'm sure that that's probably come across, your desk a few times that's happened where somebody's come in and told you that, a psychic told them that they had this or somebody told them that they had a feeling that they had this.
In getting back to Dr. Jorgensen again, he stuck his neck out to come up with his strong insistence that the judge see these doctors, and had he been wrong, and had the judge had all these pretty invasive tests, including angiograms, he would have felt terrible. But he had such a strong feeling that something was wrong that he had to speak up. I've seen patients. I don't think I've seen a patient that has had a psychic tell them that they had something wrong.
Right, because at least with Dr. Jorgensen, he has the cachet to when he says something, it's coming from a medical opinion. No matter how he came about the feeling and the information, you know that he has that background. It's something totally different when somebody who doesn't even know what they're talking about says, "I have a feeling that you have cancer."
Yeah, and people will come in with feelings that there's something seriously wrong with them, and I'm not sure whether it's some of the hormones that are released by the cancer or whatever. We had a doc surgeon that was operating on an individual for a chest lesion, and she said to him, "I'm going to die today." And he said, "No, we're gonna do a surgery. You're gonna be just fine, and some minor surgery. We're gonna take a little spot out of your lung, and it's not a very big procedure." And she said, "No, I want to thank you for all you've done for me. I want to make sure that you understand that this is not your fault. That I'm going to die today." And he kind of blew it off a little bit, and she went into surgery. During surgery, she arrested. They couldn't get her heart going, and indeed she died. that surgeon was so spooked by that experience that anytime anyone mentions to him again that they think they're going to have a complication or they're going to die, he cancels the surgery. And he's done that a number of times right the day of surgery. And so that kind of thing happens, and I'm not sure how you can explain it, but that happens to surgeons occasionally in situations like that.
And sometimes, us patients were just really totally wrong. Like for years, I would experience headaches, and I couldn't explain why. And they started to get to the point where they got really bad, and I was convinced that I had a brain tumor because my uncle had died of brain cancer at a young age. And here I am in my 20s, thinking, this is the same path I'm going down. And I was afraid to see a doctor over it. And I finally went to an eye doctor just to kind of dip my toes in the medical waters, and found out I just needed glasses. So,
and that happens all the time.
Right.
So that some of those things that people think that I've got something serious going on are totally unfounded. And that's very true.
So I can tell you that I have zero medical intuition for myself, that's for sure. Sometimes when I go to the doctor, I'm way off base with what I think it is. And sometimes when it's serious, I'm like, well, I'll just wait and see what happens. So you never know which one's right. So always trust the professionals.
Right.
So as you're getting these stories and as you're collecting these stories for the book and people are starting to share them with you, it probably eventually got to the point, though, where you didn't have to ask them anymore and people were just coming and sharing with you. How did you discern what was, were there any that were just too fantastical to believe? Were there any that you're like, I couldn't put this in the book because nobody would ever believe that?
I went to people that I knew. I've known these doctors, most of these doctors, for a very long time. So I know what kind of people they are, and there were a couple doctors that had really phenomenal stories that I knew. I'm not going to mention their names, but I knew these doctors were not up and up and would tend to exaggerate a little bit. And I didn't include any of those stories in the book because I just wanted to make sure that these were straight arrow kind of doctors that didn't want to exaggerate at all. And so, I heard some fantastic stories that I didn't think, considering the source, I didn't think they were appropriate for the book at all. And the stories in the book are fantastic enough, and they're from these ordinary, routine doctors that have no reason to make up these amazing stories. And actually, they really stuck their neck out in telling these stories because they were afraid that they might be criticized for having these experiences.
Well, we are talking with our guest, Dr. Scott Kolbaba. The website is physiciansuntoldstories.com. That is also the name of the book. If you have any questions, 508-996-0500, 877-996-1420. Those are the numbers to call in. You can also share your questions in the chat room at SpookySouthCoast.com as well, or email them spookycrew@SpookySouthCoast.com, or on Twitter using the hashtag SpookyLive. We did talk a little bit, Doctor, in the first hour about accepting the idea of a higher power. And do you feel like with collecting these stories and with the people that you've talked to and sharing these stories, is it more of the fact, are you kind of just looking at this now, as much as you have this education and as much as you have all this experience in working in medicine, do you see yourself as kind of just a tool for this greater being to be able to take care of people?
Well, I think doctors and myself included, this is our work. We see people every day with sore throats and colds and so forth. And I don't think we're helped necessarily by a divine power for those kinds of things. But I think we are touched by a divine hand more than we realize. And again, it's not for every patient. I can think of cases where you go through a whole day and you see some ordinary routine things, and I don't think anything I don't feel anything that's made a influence on me. But there are cases where I'm recognizing more and more that maybe that hunch I had was more than just a little hunch. My partner has a strong feeling about that. Dr. Bourne is my partner. And he's had cases where, one case, for example, he was clearing a patient for surgery for an orthopedic surgeon for total joint surgery. And he, after he did the exam and physical and so forth, he had this little naggy voice in the back of his head saying this guy needs a stress test. And he tells me that he's had that experience enough that he knows when he hears this little naggy voice, whatever it is, whether it's a divine thing or just from his experience, he acts on it. And he called the individual up and he said, "You need a stress test." Well, the guy was a little hesitant to have it done, but he finally agreed. And sure enough, the stress test was very abnormal. He ended up with a bypass surgery before his main hip surgery, and that's basically saved his life. So we do have these things that happen to us that you can't quite explain, but they don't happen with every patient, for sure.
But even then, even the routine stuff still has an impact on that person's life and still has an impact on the course of the direction of their life. So in a way, you're still adjusting what fate was. Like if fate made them fall out of a tree and break their leg, then you're coming in there as a tool of fate to reset that leg and to get them on the path of being healthy instead of being somebody that has to, say, walk with a limp for the rest of their life. So it might seem like it's mundane, but in the end, it's still being a tool of some sort of greater plan.
And sometimes we forget about that. When I visit other doctors for various things, I've had a neck surgery in the past, and I'm always amazed at the skill of the doctors that I have seen personally, and the ability to go in with a little tiny scope and into the back of my neck and remove a part of a disc and basically cure a significant problem I was having with numbness and weakness in my arm. It's truly amazing to me, even in the business, to have that kind of thing happen, and it's very rewarding and very reassuring.
And I've noticed on the website, physiciansuntoldstories.com, it mentions that you've received an award from the Mayo Clinic Alumni Association. It seems like the medical community has embraced this book. Do you feel that learning about these stories, about these different types of incidents that you cover in the book, do you feel like it would be beneficial for up-and-coming medical professionals to learn these stories as part of their training? Should part of the course of study be to take a course in some of the things that might happen to you when you're working in this field, such as these?
That's one of the reasons I wrote the book, is to have people be aware that these things happen and that to pay attention for them and to actually use them, to count on being helped in some of your diagnoses, and also then to be able to talk with patients. That doctors should be able to talk with patients about spiritual matters that may result in healing that takes place without medication in some cases. So, yes, that was one of the purposes of writing the book. That I was hoping doctors would learn more about the spiritual side of medicine.
And in the final few moments that we have of the show, I would be remiss if I didn't bring this up. And I know you're probably expecting me to mention the Affordable Health Care Act, but I'm actually going to mention the fact that you are an award-winning pumpkin grower. And my co-host, Matt Costa, is actually very impressed with people that can grow large pumpkins. So I saw that in your bio, and I was like, well, that's definitely something that, you have to have a little bit of a metaphysical touch to be able to grow some of these mega pumpkins.
Well, we've done some strange things in our lives, and one of the things, my friends accused me of doing things in a big way, and we won. There's a local contest here called the Sycamore Pumpkin Festival, and it's one of the largest festivals in the state, interestingly, and we won that 2 years running with our largest pumpkin. We also have a large family, 7 kids. I'm not sure where they came from. We have a large dog, a Newfoundland, 142 pounds. So we try to do things in a big way in our family.
Well, that makes sense. You need large pumpkins because that's a lot of people that want pumpkin pie. So
that's for sure, and that provides a lot of pumpkin pie, pumpkin soup, and whatever.
And I know that you tease a little bit in the about the author page that there could be a second version of the book, but I'm assuming that you've been collecting enough stories that there has to be a volume 2 coming somewhere in the works.
Yeah, I'd like to do another volume of stories. I'm thinking, doctor stories. I'm collecting a number of doctor stories, and nurses have a ton of stories. Also, they're really in the trenches in the hospitals, and they see stuff, I think, sometimes more than doctors do, that are unexplainable. So I'd like to do a nurse book also. Just
really quickly, do you feel like there's less of a apprehension about sharing the stories amongst nurses than there is amongst doctors?
I think there is. I think they don't feel that the potential criticism from patients that would then avoid the practice of that individual. So nurses don't have a practice of their own in most cases. So I think there's that concern that if I come forward with these stories, patients are going to avoid me because they'll think I'm a crazy doctor, for example.
All right. Well, Dr. Scott Kolbaba, we thank you for joining us. We look forward to talking with you when the next book comes out. And thank you very much for sharing this topic that, was previously so taboo, but now we can get it out there and now we can have people actually discussing it.
Thanks, Tim. It was a pleasure.
All right. You have a great night. We'll talk soon.
Thanks.
That, again, is Dr. Scott Kolbaba. His website, physiciansuntoldstories.com. That is also the website. It's the website and it's the name of the book. So you can go to the website and you can get the book there. You can also get it wherever else books are sold. I highly recommend picking it up. It's very eye-opening, and it'll certainly make you think, too. It'll get you in the mindset a little bit of what medical professionals go through when treating us, and that they have to actually be willing to let down their guard to accept some of these stories as well. So a fascinating discussion, and certainly something that I look forward to discussing again in the future, and we would love to hear your personal stories about. Shoot us an email, spookycrew@spookysouthcoast.com, if you've ever had a strange and unusual paranormal experience related to medicine, whether you be a doctor or a nurse or a patient or what have you. So in the final moment that we have of the show, we do want to give away a pair of tickets to the Provincetown Paracon, provincetownparacon.com. If you want to get your tickets, I mentioned earlier in the show how you can win them from me on social media later on in the week. So stay tuned to my social media page and to the Provincetown Paracon Facebook page if you want to get involved with that. But I will ask this question. And the number is 508-996-0500 or 877-996-1420 if you want to win. And the question I am asking, we mentioned Dr. Elizabeth Kubler-Ross, and we mentioned about the 5 stages of grief, and we mentioned about her work with near-death experiences. So I just want to know, what is the name of the seminal work that she had that influenced the medical community on this topic? What is the name of that book that she wrote that became the standard bearer for helping physicians deal with death? And what is that book that same book also led to her with this research into near-death experiences? So if you can call in with the name of that book, 508-996-0500, the first person to do so will win a pair of tickets to the daytime Saturday event at Provincetown Paracon. And that's why we won't be here next week. There will be no show, but we will talk to you the week after that. Stay tuned to my Facebook page to win those more tickets. And until next week, for Matt, for Stephanie, for Chris, I'm Tim. Stay spooktacular.